Welcome to our Doctor Channel, your destination for reliable medical information, breakthrough research, and insightful discussions on all things health-related.
When someone smokes weed, the active compound responsible for the psychoactive effects is delta-9-tetrahydrocannabinol, THC. The effects can vary from person to person, depending on factors such as the individual's tolerance, the strain of cannabis, and the method of consumption. Here's a detailed description of what happens to the body when smoking weed. Short-term effects. Euphoria and relaxation. 1. THC binds to cannabinoid receptors in the brain, leading to the release of dopamine, which creates a sense of euphoria and relaxation. Altered perception of time and space. 1. Marijuana can distort the perception of time and space, making minutes feel like hours. Increased heart rate. 1. THC can temporarily increase heart rate. 1. This effect is more pronounced in some individuals and may pose risks for those with heart conditions. Dry mouth and red eyes. 1. Smoking weed often causes dry mouth, cotton mouth, and red eyes due to blood vessel dilation. Munchies. 1. THC can stimulate appetite, leading to increased food cravings, often referred to as the munchies. Coordination and motor skills. 1. Marijuana can impair coordination and motor skills, affecting activities such as driving. Memory and concentration. 1. Short-term memory and concentration may be temporarily impaired. Long-term effects and risks. Respiratory issues. 1. Smoking weed can have similar respiratory risks as smoking tobacco, such as chronic bronchitis and respiratory infections. Cognitive function. 1. Long-term heavy use, especially in adolescence, may impact cognitive function and IQ. Dependency and addiction. 1. Some individuals may develop a psychological dependence on marijuana, and in some cases, there may be a risk of addiction. Mental health effects. 1. Marijuana use has been linked to mental health issues, including anxiety, depression, and an increased risk of psychotic disorders in susceptible individuals. Reduced motivation. 1. Chronic use may lead to a condition known as cannabis-induced demotivation, characterized by a lack of motivation and reduced goal-directed behavior. Social and occupational impact. 1. Excessive use may interfere with social and occupational functioning. Medical benefits. Pain management. 1. Cannabis is used for pain relief in conditions such as chronic pain and neuropathic pain. Nausea and vomiting. 1. Medical marijuana is sometimes prescribed to alleviate nausea and vomiting in cancer patients undergoing chemotherapy. Appetite stimulation. 1. Cannabis is used to stimulate appetite in individuals with conditions such as HIV/AIDS or cancer. Important considerations. 1. Individual variability. The effects of marijuana can vary widely from person to person. 2. Legal considerations. Marijuana is illegal in many places, and even where it is legal, there are restrictions on use. 3. Medical supervision. Medical use of marijuana should be under the supervision of a healthcare professional. It's crucial to approach marijuana use with awareness of potential risks and benefits, and to make informed decisions based on individual health, legal considerations, and personal circumstances. If you have concerns about marijuana use, consulting with a healthcare professional is advisable.